If I try to compensate for a lack of bone by placing a dental implant that is too skinny or too short, it's like building a deck with too small of a footing in the ground. It's just not gonna, make the cut long term. And so we fortunately live in a day and age where bone grafting has become a fairly predictable modality for rebuilding or reproducing the condition that used to exist there in terms of volume. There's a lot of different methods of bone grafting, from simplest to most complex. A small defect in the bone we treat with what we call a particulate graft or a putty graft. It's akin to spackling a little defect in your drywall. If a patient is missing either height or width of an area of bone, we'll employ a more intermediate technique called a block graft, whereby literally a block of bone is moved either from that same patient from a different area, a donor site, or from a separate human donor into the deficient area, fixated there for a period of months, and then that essentially becomes their bone with time. And in the most complex and severe of defects, we utilize a protein called BMP. It stands for bone morphogenic protein. You put it where you want bone to grow and it magically appears. It's really pretty impressive stuff. Some bone graft we place with the implant, and thereby not adding any recovery time at all. If grafting is a prerequisite to implants, it's usually about a 6 month recovery prior to implant placement.